The process of diagnosis disease in patients involves several steps that allow a doctor or healthcare professional to collect information. What is a diagnosis? When you don't feel well, you see a doctor because they are a trained medical professional who can diagnose why you are sick. The diagnosis is the identification of a disease, disorder, or other condition that you may have that is causing your symptoms. Diagnoses are sometimes very easy to come by, while others may be a bit trickier. In order to make a good diagnosis, your doctor will go through a process that involves several steps, allowing them to gather as much information as possible. Let's discuss the steps of that process so that you have a better idea of how a diagnosis is made. Ready to get started? Step 1. The medical history. The first thing your doctor will do when you come to the office is get your complete medical history. This involves collecting information about any past and current symptoms, any diseases that your family members may have, and collecting any other information that may be helpful, such as medications you may be taking. You might think that lab tests and other diagnostic tools are more important than your medical history, but they can carry important clues the doctor might need. The doctor will also tell you about how you are feeling, how long you have been feeling that way, and any external influences that may be factors. This gives your doctor a good foundation from which to move forward. Step 2. The physical exam. After talking with your doctor, they will want to examine you physically. This includes collecting your vital signs like your blood pressure, pulse, and temperature. These measurements can provide a lot of information to your doctor. Your doctor may also listen to your lungs and heart with a stethoscope, feel or palpate parts of your body like your lymph nodes and abdomen. Test your reflexes, use percussion or tapping to listen to sounds in your body, look at your eyes, ears, and mouth, and examine any other places they think may be important. This physical exam allows the doctor to see, feel, and test your body to find out what is abnormal and what hurts. It's important to let your doctor know where you are experiencing symptoms so that they can more closely examine those parts of your body and collect more information for their diagnosis. Step 3. Performing diagnostic tests. The next step in the diagnostic process is to run some tests. Usually by this step your doctor already has a good idea of what the diagnosis is, and the tests are run simply to confirm this diagnosis. Other times though, your doctor may not be quite sure, and the tests are used to rule out certain diagnoses to narrow down the field of possible options. What kind of tests will your doctor run? It depends entirely on your symptoms and the suspected diagnosis. Your doctor may order blood work that will tell them how different organs are functioning, or imaging tests like a magnetic resonance imaging (MRI) scan, X-ray, ultrasound, or computed tomography (CT) scan to look inside your body. Respiratory tests, exercise tests, or any number of other diagnostic tools can also be used to provide information. Step 4. Drawing conclusions. It's time to put it all together to form the official diagnosis. Again, sometimes this is fairly straightforward, while other times it may require a few runs through the diagnostic process. Once you have been diagnosed with something, your doctor will be able to provide treatment options that are appropriate for your symptoms and disease. Throughout this entire process, you are your best ally. Providing accurate, honest, and clear information about your symptoms and pain is the best way for your doctor to make a diagnosis. What are screening tests? When you don't feel well, you visit your doctor to get checked out. The doctor might take your temperature, draw some blood, and perform other diagnostic tests. These are helpful tests to figure out why you aren't feeling well and treat whatever is causing you to be sick. But sometimes a doctor will perform tests when you have no symptoms at all. These are called screening tests, and they test whether you have or are at risk for diseases or disorders in early stages, when they may not yet be causing symptoms. Screening tests are important because they can detect problems early, when they are easier to treat. These tests can also help detect changes in your body over time when you have them done routinely. Many different screening tests can be performed. Some depend on your age, your gender, your lifestyle choices, such as diet and exercise, your family history, your heritage, where you have lived in the world, and more. Let's take a closer look at some important screening tests and see how they can help in the early detection of disease. What are antenatal screening tests? Believe it or not, you can have screening tests done before you are even born. These are called antenatal tests because they are done before birth. Amniocentesis samples the amniotic fluid around the fetus with a needle. This screen tests for chromosomal abnormalities, such as Down syndrome, neural tube defects such as spina bifida, and genetic disorders such as cystic fibrosis. Amniocentesis is a very good screening test because it can indicate with a high level of certainty if these defects are present, but it can't tell you to what degree. Other advanced level testing may be needed to gather more information. Chorionic villus sampling or CVS is another antenatal screening test that can be used to test for chromosomal and genetic defects, as well as sex-linked disorders such as muscular dystrophy. Chorionic villi are projections off the placenta that are important during pregnancy because they provide maximum contact with the mother's blood. A sample of chorionic villi is taken through the abdomen with a needle or through the vagina with a tube that reaches up to the placenta. During your pregnancy, your doctor may also order blood tests to ensure there are no other potential complications. Like most other blood tests, this will involve a small sample drawn from your arm. It will be analyzed for different things, such as anemia, a condition where there are too few red blood cells, or the Rh factor, a type of protein on the surface of red blood cells. This is important to test for because if the mother is Rh negative and the baby is Rh positive, then the mother's blood may attack the baby's blood. Infant and child screening tests. Don't worry, there are plenty of screening tests that can be done after you are born. One that is required for all newborns in the US is a blood test for phenylketonuria or PKU. This is an amino acid disorder that makes it difficult to break down phenylalanine in the food we eat. This test is very important. If left untreated, babies with PKU may have developmental and intellectual disabilities later in life. As you get older and your teeth come in, you'll want to have regular dental examinations to monitor caries or tooth decay. Tooth decay can often be prevented. If it is present and left untreated, it can lead to pain, holes in your teeth, and even tooth loss. It's never too early to get dental checkups. Another important screening test for young children checks for visual problems using a Snellen chart. This is that chart with the large E at the top, with rows of letters that get progressively smaller moving down the chart. For this test, each eye should be tested individually. The results provide a baseline for your vision and help determine if there are visual problems in either eye. Hearing tests are also important screening tests for young children. To test your hearing, you will be put in a soundproof room that excludes external noise. An audiologist will play sounds and you will be asked to push a button that signals when you have heard the noise. Results are plotted on an audiogram, which is a chart that compares what you actually heard to what you should have heard. Adult screening tests. Screening tests continue throughout life because as you grow into an adult you become at risk for different types of diseases and disorders. For example, doctors will check your blood pressure, temperature, weight, and pulse to keep track of if and how these change over time. Changes in these metrics could signal early stages of diseases like hypertension, high blood pressure, or more serious diseases like cancer. You'll want to get regular vision checkups as you age because things like vision changes can be monitored, as can diseases like glaucoma. This is a disease that damages the optic nerve in your eye. Glaucoma can be tested for with a pressure test that sends a puff of air at your eye and measures the eye pressure to see if it changes over time. Women need to be routinely screened for cervical cancers with an annual Pap smear. This test checks the cervix for cancerous or even pre-cancerous cells. Women should also get regular mammograms, which are X-rays of the breasts. These are useful for detecting breast cancer. Men also need yearly checkups, which should involve screening tests for testicular and prostate cancers. Your doctor will check for lumps, swelling, pain, and may even run blood tests to monitor you and catch warning signs early. Diagnostic techniques are used to figure out what disease, dysfunction, condition, or ailment is affecting an individual. These techniques are used to narrow down the possible options to come up with a final diagnosis. Oftentimes, after initial screening tests are performed, a conclusive diagnosis has not been reached. It is in these times that further diagnostic testing procedures will be performed. What are the different diagnostic imaging tests? Diagnostic imaging tests are the most common types of procedure used after screening tests. The following will explain the types of tests that are used to aid in the diagnosis of a patient's condition. 1. X-rays. X-rays are used to detect issues pertaining to the musculoskeletal system of a person. Meaning that X-rays are used to identify issues having to do with our bones, muscles, ligaments and tendons. For example, if a person fell off their bike and hurt their arm, an X-ray would be taken to confirm whether or not a bone has been broken. In some instances, X-rays can be used with contrast. The patient will ingest a liquid or pill, or be injected with a substance that will highlight a specific area when the X-ray is taken. 2. MRI. MRI stands for magnetic resonance imaging. In this procedure, a high-powered magnet is spinning around the patient that delivers information through a scanner and creates an image that doctors can look at. An MRI is also used to detect issues within the musculoskeletal system. However, the MRI is a bit more specific than an X-ray and is able to pick up a lot more information. With an MRI we can view the organs and soft tissues of a person. You can even take an MRI of someone's brain. The MRI is very useful in detecting and monitoring disease processes such as cancer or organ issues. 3. Ultrasound. Ultrasound is a very common procedure that can be used to detect the functions of certain organs. It is best known for testing and monitoring during pregnancy. The ultrasound tool sends tiny vibrations through the area being tested. When those vibrations hit the affected area, they travel back to the ultrasound tool which then creates an image. This image outlines the area being looked at. If a pregnant lady goes for an ultrasound, the tool will show the outline of the baby. In addition, it will show the heartbeat and other functions of the baby to make sure it is healthy. The image created by ultrasound is like a live video feed. 4. CT/PET. CT stands for computed tomography and PET stands for positron emission tomography. A CT scan is comparable to an X-ray, except that a CT scan takes many X-ray images from multiple angles. All these images are then combined using a computer to make a very detailed image of the area being tested. With a PET scan, a radioactive substance is put into the body. This substance is picked up by the PET scan to show how certain organs are working inside the body. The PET scan not only shows images but also a live video feed of the radioactive substance traveling through the areas being tested. Tissue biopsy. When a patient is suspected of having a disease that affects skin or internal organs, a tissue biopsy is often taken. In a tissue biopsy, a small piece of the suspect tissue is cut from the body and tested. The biopsied tissue can be viewed through a microscope or be put through certain biochemical tests to determine what is wrong. An example of when this is used is when someone is suspected of having cancer. If a patient went to the doctor with a strange mole, a tissue biopsy would be performed to see if the area is cancerous or not, and to narrow down the diagnosis. Electrocardiography. Electrocardiography (ECG) is a test that is used to find out more information about the heart. This is a very common diagnostic test used because heart disease is a major killer in our society. If a person is suspected of having something wrong with their heart, this test is issued. An ECG is conducted by placing electrodes at certain areas around the body. These electrodes are connected to a machine that will measure the electrical conductivity of the heart. This means that the beating and function of the heart is measured. If the measurements are skewed, it lets the doctor know something is wrong. Body fluid sampling. Body fluid sampling is used to test the blood or urine of individuals affected by certain diseases. The blood or urine sample taken from a patient can be put through chemical tests to determine if the person has a disease or certain dysfunction in their bodies.